from the National Press Club, who is responsible for stakeholder relations, will assist with the question and answer session. So, Minister, once again, thank you very much, and I hand over to you.
Thank you very much, Val, and all the members of the media and the public. If the host could just help us open.
We're having a technical challenge here. If one of my colleagues from GCIS could assist.
Hi, Val.
Well, perhaps while we wait for this problem to be solved, I will just perhaps share with you a little bit more about the Newsmaker of the Year. I think, we can all agree that no story dominated the news over the past 365 days as COVID did. From that first case I mentioned through to the President's announcements, what we've come to call the family meetings, the fight on the front line to prepare the health services to deal with COVID cases, the daily tallies of the new cases and the sad deaths, the scientists who've been working relentlessly to try and come up with treatment protocols and with the vaccines. This has certainly been the story of the year. And what we're going to ask the Minister is if he will receive this award virtually, and we make the award in honor of all those people that I've mentioned who have been at the forefront of fighting the virus over the past year, as well as to honor those who have lost their lives to this virus. So I trust that the Minister will accept this on their behalf. Thank you. It's good to see you, Minister. Thank you very much. I hand over to you.
Thank you very much, Val, and to all the members of the media. Thank you for this evening. I don't have a lot to say, but just to say that the whole year has been a rather tumultuous year with a lot of work that had to be done. I want to thank the media for all the work that we have done in informing the South African society about the issue around the COVID-19. And we also want to thank all the health workers who have done everything to help to support our people and save the lives of so many who were affected. And we also convey condolences to the families that lost their own family members in this whole pandemic. I think there's a bit of hope now when we start the processes of vaccination, and we really hope that one of the days we'll look back and say we can now take control of our lives and that we have defeated the virus and that we are able to get back to our normal life, build our economy, and make sure that people are able to live a normal life where they're able to go about with their daily activities without the restrictions, without all the constraints that we've got. But in the meantime, it's important that we continue to use the face masks, the distancing, social distancing, hand washing, sanitizers. All of this needs to be done right up until we finish with the vaccination program. So for this evening, I believe that the award that you are making is an award for all the South Africans who are out there fighting the COVID-19, for the South Africans amongst the health workers who have been fighting, and all those who have had to endure the difficulties of the COVID-19 pandemic. With that, we would accept it on the basis that we all understand that those are the people that this Events Award is honoring. Thank you.
Well, thank you very much. Thank you very much for that, Minister. For accepting it in the spirit in which it is given. I think that we should jump straight into the questions and answers because I know that your time is limited. We do have a couple of questions which came in advance. So I'm going to ask Mosidi if you would be happy to start the question session. I suggest that we can take 3 or 4 questions at a time, if that's convenient for you, Minister. And we'll see how we go, just to try and give as many people as possible the opportunity to ask you their questions before we get to the sort of final round and wrap up. Mosidi?
Good evening to everybody. My name is Mosidi, as Val has mentioned. So I will be taking a couple of questions and then affording the Minister the opportunity to respond. For this round, we'll start with 4 questions. The 4-question, Minister, being, how good is our vaccine supply? Where are we getting from? And what can we expect in terms of the numbers and new vaccines? And the applicants now in, the applications now in, and if we may expect vaccines from different countries like Russia, and by mid-year, which groups do you expect to have been vaccinated? What is next after essential workers? So I think this one question has 3 questions to it. So I'll take one more if that's okay with you, Minister. The next question, therefore, is how it came about and its impact on dealing with the problem of healthcare and the vaccine rollout. For example, the efficacy of vaccines against the strain, how it has affected brand South Africa, for example, countries bearing entry of South Africans. I'll hand over to you, Minister.
The vaccine supply globally is subject to a lot of forces. Firstly, the rate at which companies are able to produce for the demand of the rest of the world. Secondly, that some of the major powers have put a lot of resources to secure a lot of vaccines ahead of some of the low and middle income countries such as South Africa. So that will affect the way we receive the vaccines. So we have ordered mainly 2 vaccines that we at this point have ordered from Johnson & Johnson, where President has confirmed we have had 11 million which are going to be available. Just about 3 million will start in April to June, and then about 4.1 for the remainder of the 2 quarters. We have also ordered additional amounts, but they're still under a lot of discussion, so it's not been confirmed from J&J. So we are not in a position to talk about it until that is confirmed. The second, of course, we have between now and the end of March, we're expecting about 500,000 of the vaccines, vaccines from J&J. Secondly, we've also ordered from Pfizer. We are waiting to confirm the details of the order, but our anticipation was that the first amount of what 600 and say about 600,000 will arrive here before the end of March, and then more will arrive. Between 5 and 7 million should arrive in April to June, and then after that we should get more. Again, with Pfizer, we need to sign the first agreement and then confirm the second agreement. So that is what we are looking at between the 2. But Pfizer would order 20 million. Then COVAX has indicated that they will be giving some of their vaccines already. So the 100,000 will come with the first batch. So when we say 600,000, it will be 500 that we had ordered, and then another 100,000 that would have come from COVAX. We have not ordered any others. In the meantime, we are going through a lot of discussion about getting other vaccines. So we are, for example, trying to finalize the issue with Moderna, which has made some offers. We're also discussing with Sputnik, the Russian vaccine, and that vaccine is going through the process of registration. And out of that, we hope that we'll get some, but we have not got anything confirmed. Sinopharm and Sinovac There's also been a discussion that is going on those. So once those are finalized, we can talk about them. So those are the groups that we're discussing with at the moment. And then the question of efficacy with J&J is the one that's been demonstrated to have the most effective action against the variant that is found in South Africa. The others, such as Pfizer and Moderna and them, they've also demonstrated some degree of activity. However, that was demonstrated in a laboratory setting. It's not been demonstrated in a clinical trial. So in the process, all of these are some of the considerations that we take into account as we go through the selection of the vaccines. It has affected the advent of the variant has affected South Africa. There are many countries which have become quite nervous, and in the process, they have issued bans, travel bans against South Africa. But we hope that when the vaccination process is over, it will be possible to actually get some of those travel bans reversed, because from point of view of Johnson & Johnson, it should be very clear that it has actually shown efficacy even against our current variant. So as soon as all of the scientific findings are made known to everyone, they will understand that there's no need to worry about South Africa, because we would have been able to contain it. The real issue with the variant is that it has spread to quite a number of countries. Last we checked, the variants have been found in almost 48 countries. Some of them are a bit different. However, the one that has been identified in South Africa, 501V2, we have at least concrete evidence that the Johnson & Johnson vaccine is fairly strongly effective against it. And then, of course, Pfizer vaccine is also similarly strong, although there's a slightly different strength of its activity, but it is actually useful. So all I can assure South Africans about is that the two vaccines are actually the best we have to be able to deal with the vaccine. Thank you very much. Sorry, to deal with the variant, sorry. Thank you very much.
Thank you, Minister, for that clarity. Moving on to the next set of questions, I will pose the two that were raised by Lali van Zeitman. She is a freelance journalist. Her first question being that, what are the lessons learned over the past year in terms of the public understanding of health and science? Follow on to that, she says, how can we better educate people in the future? Her last question is, what is your impression of the level of science and health education reporting amongst the journalists? The following question was raised by Sizwe Dlamini. I'm not sure where he's from, but his question is, did the Solidarity Fund donate PPEs to the government, or was the government expected to procure it, as some of us were of the impression that the Solidarity Fund would donate the PPEs? The last question, Minister, is from Vuyo, and he says, good evening, Minister. What is the current status of the AstraZeneca vaccine? What has been decided in terms of how many will be distributed via the AU facility, and how many will be used here? In what sense? That's the end of the questions.
Sorry. The question was about what lessons have been learned for the public understanding of the science and health. The last year has shown a huge amount of interest amongst the general public on details of science and health issues, how the pandemics work and how they are caused, and what the viral infection, how the viral infection spread, and also what needs to be done from the point of view of the public health policy to contain those viral infection. All of these issues have shown a lot of interest. We've actually had scientists debating and presenting very detailed scientific work which has actually sustained a huge amount of the public interest. What we found was interesting for us is that people were able to follow what the scientists were saying in such a way that they were always able to understand when a decision is taken, why it was taken in that way. I think that's a healthy way of how we would deal with issues of public health as well as issues of dealing with the pandemic. So because of all of that, we believe that it is important that we must continue to sustain that level of understanding, because in the first instance for public health, from a public health perspective, the person who has to take responsibility and take charge of their own health status is the individual, based on good information, knowing what practices to embark upon to be able to do everything that will help them to stay healthy. And it's only when they are not able to manage their own situation, when the disease or infection gets more severe, that they need assistance. So the primary healthcare is about keeping people informed so that they can make informed choices. So I think it's a very, it's been a very educational process throughout the whole of last year. But also with the journalists, I've found that most of the time they did a lot of research, they followed the debate, and they also spent time to understand what the science behind it all was, and they've actually fairly reported on the pandemic from the point of view of the science behind it, the outcomes of various researches, and also going all out to look at what's going on in other countries. So they have actually done quite a great job in keeping the public informed. The Solidarity Fund, yes, did donate the PPEs. The amount of money that was put in the Solidarity Fund was used to buy a number of items of PPEs, which were subsequently handed over to the department and distributed in various provinces. So, the amount of PPEs that we've got was a combination of what the department bought from its own budget, as well as what it can come from those donations. The Solidarity Fund didn't just deal with PPEs, but they also assisted to fund ventilators. They also assisted to fund some programs of community awareness supporting NGOs. So there has been quite a lot, and also buying diagnostic kits when we needed to buy some of these during the time when it was difficult. So they actually played quite a role in that regard. So there has been quite a lot of assistance that came from those donations, and we really appreciate it. Then the current status of the AstraZeneca vaccine, we had ordered 1.5 million vaccines, and we took possession of the first 1 million. When we discovered that there was a challenge that needed to be re-looked at in relation to AstraZeneca, we then felt it was important to do some research, and the scientists are still working out as to what exact researches we need to be doing on that. In the meantime, we've offered this to the African Union platform. So 1 million is going to be going to the African Union platform. All of the discussions have happened. The African Union will buy it at the same cost at which we bought it from Serum Institute. And in the process, what we're expecting is that the legal teams must finalize the agreement so that they can actually be released to the various countries where it is destined. So we haven't used any of it, and we're not going to use it immediately until we get a clear guide from our scientists as to what is the best way of utilizing AstraZeneca. You might have seen that in the public debate, some of the people have gone out to say that maybe we should use it for research, we must use it for different things. So all of that, we're allowing that discussion to continue. But at this point, all of the orders that we're getting, we're not immediately going to be sourcing in AstraZeneca vaccines. Once we've got a decision made, we'll then be able to decide how to take AstraZeneca forward. Even with the African continent, we have had this discussion because a number of countries don't have as much of the variant like what we have. So they are free to utilize the AstraZeneca because it's still effective in a number of countries, except the 501v2 variant. Thank you.
Thank you, Minister. Moving on to the next set of questions. The first one being that we understand the move to level 1, but are you not worried about the increase? What are the plans for a possible third wave next month? And is there a risk of stopping economic activities again? And lastly, what is a compromise between South Africa getting back to work and dealing with COVID-19 in 21?
Okay. No, thank you very much. We have felt it was important to move to level 1 because it is the level of daily cases and the impact on the hospitalization, the numbers of deaths, and the general extent to which our society is affected by the COVID-19. So this tends to be what we look at to decide what level of restrictions are needed. In this case, it is now justifiable because we're getting to a point where we're getting from about 20,000 positive cases in a day, we're getting to about 1,500 or so a day. It's still high, but nevertheless much, much lower than what we had seen before. We also look at the positivity rate and look at how many in each batch of 100 people that are testing, how many are testing positive. And all of those who are testing positive were very high at the beginning during the peak. That's gone much lower down now. So as a result of that, we have to continue with the containment measures, the use of masks, the sanitation, and so on. And in that process, we would remain vigilant to see whether there's any change that's suggesting that the resurgence is coming. In the process, we need to understand that whilst we may not be able to predict accurately when the next surge is coming, it may well come, particularly when you've got huge movement of people during the public meetings or during Easter weekends, during the the Easter holidays when people are moving up and down. That might have an impact as well. But we will be observing to see what is happening at that time. The compromise in this whole situation is that we need to insist on the use of mask sanitation, sanitizers rather, and distancing, so that it can further delay the rapid, resurgence of another wave. If we are able to, keep to the distancing, because we think that the reduction in the numbers in the last wave was actually because of the extent to which people started using masks and so on. If we can keep it like that, we believe we can delay the next wave. But there is a suspicion that we probably might end up with another wave late April, May or so, but there's no clear model that tells us that. So it's just a matter of a feeling that it's possible that that might happen. But it also depends on how we as a society behave. Thank you.
Minister, the next question says, how many frontline workers have been vaccinated in the country so far? And regarding the Russian vaccine, how much has the government spent on it? Has the Russian vaccine been tested and checked for the expiry date? And then the next question from Sizwe Dlamini says, when do we expect to achieve a herd immunity? And will the rest of the population be encouraged once we reach this immunity? And then, Minister, I'd like to squeeze in an interesting question here that says, it's actually from SK Mapala, who says, how do we rope in the religious sector in its entirety in assisting with the positive advocacy of vaccine rollout? The general perception, true or not, is that this sector in particular is not entirely on board. Thank you, Minister. Over to you.
Thank you very much. I don't have the latest figure as of now. However, up until yesterday, in the evening, we had 82,000 health workers who had already been vaccinated, which is above the, well, just a little bit above the target we had set. We should have reached 80,000 by yesterday. So we think that the vaccination program is going on well. And so that, from that point of view, would have loved to see many more being vaccinated, but we've got a limit to how many vaccines we can receive, because as they are being processed, they are busy labeling them, and therefore it takes a while for them to be ready to be brought in here. So that's what's really slowing the process down. But we hope that with time they will be increasing that supply. The Sputnik vaccine, we have not paid money yet for Sputnik vaccine, but it seems to be almost the same price as what we have from Johnson & Johnson, and so which is around $10 or thereabout. But we have not started any concrete negotiations on the pricing of it. But that's what it's generally estimated at. At this moment it has been they've submitted application for registration, and the paperwork is being processed. And the processing of the paperwork, they continue to submit new information as requested. So at some point they will be able to give us a concrete outcome as to where that vaccine is. I will be meeting also with the ambassador, Russian ambassador, to take the discussion forward, because we have been interacting with the Gamaleya Institute, which is manufacturing the Sputnik V vaccine. And there is quite a lot of discussion that is going on amongst our scientists about the details and the components that are involved inside the Sputnik V. But I won't go into those details, just to say that there's quite a lot that's being discussed at that level. Herd immunity is a very elusive issue. It depends on how fast that virus is replicating. They calculate it based on that. Then they also
If you like nice things at a nice price,
support vaccination and encourage people to take part in the vaccination. So those who might not be on board, I'm sure there'll be space to engage with them. Thank you very much.
Thank you, Minister. The next question is from Luvuyo from the SABC. And the question says, with Aspen going into agreement with J&J, will Aspen in its Eastern Cape produce vaccine in the country on behalf of Johnson & Johnson? And how much will be produced? Can we then see Aspen SA in particular as a provider to the rest of the continent? The next question is from Siyavuya, who is the editor of the Cape Times. He's got two questions, in fact. The first one being, so much has changed since the first case was reported. How would the minister characterize South Africa's response to the pandemic, keeping in mind the corruption around food parcels and PPE? His follow-on question says, the minister has been hailed for being hands-on since the pandemic hit our shores. Out of 10, how much the minister would give himself? Over to you, Minister.
Thank you very much. Some of the issues asked about Aspen, I will not be able to answer because it's something that's got to do with Aspen and Johnson & Johnson. However, we welcome the presence of the agreement between Johnson & Johnson and Aspen for a number of reasons. Firstly, that it was helping us to advance to a point where there may be some work done in the manufacturing of the vaccines. If you look at the whole continent, there is no other part of the continent that's been participating in the vaccination, in the manufacturing of the vaccine. So from that point of view, it's been an advancement that there's this agreement. It's actually important for us to say we need more of this so that more sites in South Africa, more facilities can manufacture vaccine or participate in the vaccine manufacturing, as well as also in the continent. And what we believe is going to be one of the issues in the future is to ensure that the continent is also self-sufficient in terms of production of vaccines, of diagnostic kits, of pharmaceutical products and equipment and so on, so that when there's a huge pandemic or health emergency, the continent can rely on its own, because otherwise it means the continent could have been left behind. It was possible, in fact, that without the Aspen, there would have just been no vaccines allocated to the continent, as well as also no vaccine manufactured for the continent. So I think it's a very, very important development. We know that there'll be a lot of vaccines that will be produced, probably not as much as what we would have liked to see, but certainly most of it, we hope that it will actually be used in the continent, and a lot of it as well. We hope we will be getting our supplies also from Aspen. But the exact amounts, I'm not at liberty to talk about it because that's an agreement between Johnson & Johnson and Aspen, and so it would be a speculation from our side. But the African continent is anticipating that a good proportion of the vaccines from the Aspen will actually be available for the continent. The second issue relates to the change that has taken place in Africa over the last year. I think it has been a very difficult year. I think a lot of us have gone through difficult times, and as a result, therefore, I think we all look forward to a situation where we can, recover and get ourselves out of, the constraints that are imposed by the conditions of having to fight against COVID-19. And so from that point of view, we've seen a lot of devastation, we've seen a lot of death, but at the same time, we've seen a lot of unity of the people that have worked together. And there has been, concerning cases in relation to corruption, but the processes of investigation have gone on to deal with those. And so we believe that we must continue to work together to resolve these kinds of concerns, and also make sure that we keep supporting each other to deal with this. There may in future be other pandemics or other emergencies. If we work together, we'll be able to resolve all of those. I think that it is not probably necessary to get a score for one person. This has been a huge Team South Africa effort, and so everybody has really done their best. And I believe that it's important for us to encourage each other, to support each other, and also to work together to make sure that we do the best out of the situation, and look forward to a time when we are living without COVID-19. So I would like to say that there's been a huge amount of support and a lot of solidarity, social solidarity across. And we want to thank particularly the health workers for all the work that they've done, and all the South Africans for the work they've done. I think this has been a united team of South Africans, coming together to fight a common enemy. And I think the country has done reasonably well. Thank you.
Thank you, Minister. We've got two questions from Mwangi, who is from the Cape August. The first question being, when Minister Mkhize drove South Africa's handling of COVID, did the President task Deputy President David Mabuza to oversee vaccine rollout? Does the Minister feel sidelined? And then the second question is, how much consultation is there between Minister Mkhize, the Treasury, and President Cyril Ramaphosa with regards to funding the vaccine rollout? The last question I will take for this round is from Adri Senegal Divert. Adri's from the Business Report. And Adri's question is, can companies force employees to take vaccine as a safety measure? Over to you, Minister.
Okay, thank you very much. Thank you very much. There has been an interministerial committee formed. This interministerial committee was formed because there are aspects now that required a lot of coordination across various departments. Interministerial committees get formed whenever there is work that, even though it might be relying on one department, it might be drawing in a whole lot of other departments. And to coordinate that, it can then be done by a designated office of the president, either by president or deputy president. So this is a normal way of how things get done inside the government. So there's no sense of sidelining that you have here, but effectively what you've got is that there are a number of things. So for example, if we're talking about vaccines, the rollout has got issues of logistics, transport, safety issues, and so on. So in the process, many other departments get involved. Department of Agriculture gets involved. Department of DIRCO is very heavily involved, and so on. So because of that, science and technology, higher education, science and technology, because of that, it then allows us to create work streams to process a number of issues where each department is putting together some work to create the particular outcome that is needed. So that will happen every now and again. And when that happens, it basically means that you need to make sure that whoever is needed to take particular decisions or participate in a program is there. There is very good consultation between Treasury, President, Department of Health, Cabinet, particularly as it comes to the issues of vaccine. I'm sure we've seen how the Minister Mboweni has actually come out always very strongly to say when it comes to health issues, everything will be done to try and find the resources. We've had the President say so. We've seen the Cabinet backing all those decisions. So in the process of all of this, we've been able to see a whole of government driving the process, taking us forward. So what the Minister would then do, he would take a view and then get guided from the President, and based on what the department is looking for, and then come back for Cabinet to back the decision up and move on. So a lot of things that have been announced by the President are a subject of a consultation between Treasury, Department of Health, various departments that get involved, social development, trade and industry, etc., etc. And then a decision gets taken out of that. And when it's announced, you could rest assured that the provinces have also been consulted the premiers, in some instances, even the mayors of various districts or metropolitan council would have been consulted. So there's a whole lot of consultation process that goes on at that level. Then can companies force employees? No one can be forced to take a vaccine. It's not compulsory, but you are advised that it's in your best interest to take the vaccine, and therefore it becomes important. I think if the employer is able to explain properly, every employee would understand that it is in their own best interest to take the vaccine. Once everyone understands, there will not be a question of anybody being forced. Quite often the problem have arisen because people are not sure about issues of safety, which we have clarified, and that's why the president felt he needed to be in the forefront. That's why I participated, and a number of other leaders have also participated, just to make sure that the issues of safety are clearly taken out of the way. Then, of course, the concern will always be there because COVID-19 is a new situation, and because it's a new situation, it creates a situation, a problem where people want to know before they can continue, because there's lots of talk. You can never know what is news, what is fact, what is fake news, and all of that. So companies shouldn't force anyone, but they should actually explain to them that, in fact, it's in their interest to be able to do so. However, if someone decides not to take the vaccine, I think all we can do is to continue persuading them, because it's there are two ways of benefit from the vaccine. One, the vaccine will protect the individual, so that when they get exposed to the infection, they can get the infection, but they will not necessarily, get very sick. So, like in the case of Johnson & Johnson, it's been shown to reduce mild disease, moderate disease, severe disease. It reduces hospitalization and death due to COVID-19. So all of that needs to be understood, so that when people get the vaccines, they know that it's actually for their own benefit. But no one will actually be forced to take the vaccine, but we believe people will understand it in such a way that they'll all come forward and take the vaccine. Thank you.
Thank you, Minister. I think this is where we will leave it with the questions. To our colleagues in the media, I can see some questions still coming in. We encourage you to also raise these questions directly with the communications team in the Minister's office. This is what we have for you tonight. We'll leave it here, but let me hand over to Val Boyer, who's the chairperson of the National Press Club, to formally close this evening's proceedings. Val, over to you.
Thank you, Masidi. Thank you for taking care of the questions, and apologies to those whose questions didn't get answered. We are working on a time limit here. I think the amount of interest in this just shows how important this kind of communication is, and I would like to thank the Minister once again for making time available. Aside from the people who are on this Zoom call, obviously there's a wider audience. So thanks to the broadcast partners who have shared the evening with us. I had my own question for the Minister, and perhaps that can be a way for him to just summarize some final thoughts for today. It won't be the last time that we speak to you. And my question really was, what have you personally learned from the year that's gone past now, since you made that announcement a year ago tomorrow? And perhaps you can just include a few thoughts of your own as we draw to a close this evening. Thank you.
Thank you very much. I have also noticed one question from someone who was concerned about the rate at which our vaccination is going, that it might take a long time to get to the 40 million. We do expect that the rate of the vaccination will increase much more from April going on to the second, third, and fourth quarter. So we believe, therefore, that we'll be able to, reach as many people as possible, much more than what we have seen here today. I think that just the one thing that I think we have seen, I think it has shown, to me, it has shown that South Africans can actually work together and unite in the face of very serious adversity, such as this pandemic. I think it's important for us to realize that we all got into this completely unaware of the severity that it was going to create amongst us. But we've seen people responding very eagerly, coming in with responding to the use of masks and responding to distancing. And we've basically changed our behavior and created a new culture, which was a good sign for us to say, whenever there are challenges that we face as a country, we are able to rally together and try and find a way to make sure that our country survives. So I think that for me has been very, very encouraging. I think out of all of it, we've seen how all of us have been able to go out there, support each other, and make sure that we are able to support those who needed to be supported and move forward with a hope and optimism that we'll be able to overcome the current challenge that we're facing. But to the members of the media, thank you very much for all the role they've played in the informing the nation about the challenges that we face and how to resolve them and how to work together to try and defeat the pandemic. I think with all of the partnership, the working together, the social solidarity and the unity of South Africa is in a better place today, even though we still have not defeated the disease, but in fact, it is probably going to be easier in future to be able to face similar other challenges so that we are able to make sure that our country survives. So with that, for me, I think there's been a very good lesson of what the country can do together. Thank you very much.
Thank you, Dr. Mkhize. So I think we've done very well in terms of the time we set ourselves. Just from my side, a final thank you to you for sharing this information with us. And thank you to our partners at GCIS for helping to arrange this event. I hope it will not be the last one that we do. And then just in closing, I think it's important to just reiterate what we said about the Newsmaker of the Year award, that we want to honor all those who have been so deeply involved from your office, from the various other ministries, the scientists, the healthcare workers, other essential workers, journalists themselves who are classified also as essential workers. And to close, I think we can all just leave thinking about the 50,366, I think the total is now, the people who have lost their lives to COVID over the past year. Obviously, we in the media, we're mourning the loss of Karima Brown. And it's a reminder that each one of these people is known to people, is family of people. So we shouldn't let our guard down, as you said. We should all work together to ensure that we don't lose as many lives next year as we have in the past year. Thank you all very much indeed for joining us.
I'm sorry, can I just also say that we do wish to convey our deepest condolences to the family of Karima Brown and also to the colleagues and the media for the loss. We know that she's not the first of the media personalities to be lost, but we do want to say we really express our deepest sympathy. And of course, to the rest of the families that have lost their loved ones, we say convey our deepest condolences. Thank you very much.
Thank you very much. Thank you, Minister. Good evening.
Good evening.